Sounds good. All right, so let's get started. I'll introduce myself. My name is Ikram Massabini. I'm the CEO of MVP Network Consulting. We're out of Buffalo, New York. I have more than 25 years experience focusing in healthcare IT. We manage from hospitals to, we have close to 10,000 endpoints that we manage, close to about 1,000 physicians, give or take. And we manage their IT across the board. So I know a lot of the EHR systems. I know a lot of the processes that doctors go through, and AI came in to kind of disrupt everything. So what is AI really? Let's talk about that. I can tell you it stands for artificial intelligence, but it's not really very intelligent. Matter of fact, I think AI is pretty dumb. It refers to the simulation of kind of a human intelligent processes made by machines. It's a piece of software basically called a neural link. And a neural link, you give it input, it looks at patterns, and because you give it a lot of data, and it provides answers. So how did they build it? It's first they need a lot of data to give you answers. So they downloaded the entire English internet, everything that we know about, every single page, every single image, every single article, everything. And then they saved it as one big text files, and then they gave a number to every single word. So now AI can look at those all bunch of numbers and can recognize patterns in those numbers. So when you ask it a question, any question you ask has probably been asked somewhere else before. And then there is an answer for that. And that's how it works. It works through patterns. But it gets better as you train it, as you tell it what the patterns are, right? So how does it work is then they copied the structure of a brain and they put a lot of processors in it. So it requires a lot of power to run and fed it a lot of detail and then kind of let it do its thing as they trained it billions and billions and billions of times. They ask it a question, their answer would be wrong. They would guide it until it got it to where it is today. And that very dumb brain became smart. So it, in general, it allows the program can recognize patterns. It can identify faster than people can because it's a computer. It uses biometrics and can eliminate the need of passwords. A lot of things that AI can do. Here's the facts. ChatGPT took an IQ test and got 155. Einstein was 160. And that's ChatGPT 3.5. We're on ChatGPT 5, by the way. That's just the tip of the iceberg. ChatGPT 4 was 10 times smarter than 3.5 in just a few months with not a lot of programming because it learns from itself. And because everything is stored, it could learn fast and it could teach itself how to recognize pattern better. Uh, Scientists are assuming that ChatGPT will reach 1600 IQs. And if it reaches that level, we won't be able to understand it that well. But why does it matter in healthcare? So, what if you're able to walk into a visit and you have a patient there and you click on a button and then you have the regular visit? You check vitals, you do what you're supposed to do, you check the patients, and ChatGPT or an AI, because ChatGPT is just one of them, right? There's lots of them now, will then be able to automate routine tasks, will listen to you and automatically put in all your notes into your charts, will support decision making and gives you some ideas on what you should look at. What if you told it you're going to give a referral and that referral, the AI heard the referral and automatically created that referral form and sent it on your behalf? There's a lot that AI can do in healthcare, but it's all working around something called the Risen framework. For you to use it right, and if you have a free chat GPT now or a Copilot or any different GPT or AI that you're using, think about the prompt that you put in there. Uh, First, tell it to act as, give it a role. So act as an admin, act as a nurse, act as a doctor, and give it instruction of what you want it to do. And I'm going to give you an example of that, and give it all the steps that you want it to go through and what the end goal is, and really narrow it for it. So it's called the Risen framework. And when an AI is integrated into your EHR system, like MedDent or uh, Epic or Cerner or whatever you're using, the prompting is already pre-built in those applications. So it will do the work for you automatically. It's an AI that is now waiting for a trigger to happen. You click the button and you triggered it to start listening, to take action on your behalf. As an example, you tell it, act as a medical documentation assistant for a primary care physician. I want to create a concise clinical note from today's patient visit that will be entered into our EHR system. Then you give it the steps. The patient is 56-year-old female with type 2 diabetes and hypertension, presenting for routine follow-up. Blood pressure today is this. The A1C is that. No change in medication. And I'd like to note the following, the SOAP format, and avoid making any medical recommendation or assumptions, really narrowing it down. Now, these prompts will be built into the AI that are built for your EHR system, and that's what you're paying for. You're paying for somebody that trained that AI and gave it the correct prompts to be able to do the work for you. Or act as a medical billing coding assistant. I need help assigning an appropriate CPT or ICD-10 codes. So this is how I see it kind of coming up and working within the healthcare environment. But AI tools like ChatGPT, Copilot, which costs $30 a month per user, and what have you, Epic has its own generative AI, are great. And coming soon, like Suki AI for MedDent, if you guys are using MedDent, because it's a big tool here in Western New York. Or this is Epic and the Bridge AI that they're building into Epic. A lot of people actually are migrating to Epic. It's a big system, but it will do scribe, adding billing codes, automated referral letters, an assistant that listens to the visit and takes perfect notes every single time. That's the idea of AI. Now, does that mean you're not going to need an admin with you? I'm not sure of that yet. It will speed you up though. It will make it where you don't have to go after the fact and take notes. It will make your patient care faster and more focused on the patient, not on the technology. Epic and Cerner are also going to use Heidi AI. They're training it, and we've been working with them on some of that work. My AI prediction is soon enough, in every business, every user will have AI agents working with them. Kind of like email and a website in every business. A few years ago, everybody's like, oh, I think I need a website. I think email is going to take off. Well, now everybody has a website and everybody has email. That's going to happen for every user in your company eventually with AI agents that will do some of the work. And some agents will replace some users when there are very menial tasks. But I really see it as a complement, not a replacement to humans. But be careful, because AI is not HIPAA compliant. ChatGPT will tell you we're not HIPAA compliant because once you share information with an AI, it shares it with everybody else. So how do you get it to be HIPAA compliant? It has to be built in within your environment, within your EHR application, with guardrails that the HR provider is building around that AI. So data sensitivity. So some physicians I know will upload tests into ChatGPT and ask it its opinion. Don't do that because that information will be shared with among everybody else that uses ChatGPT. And it's definitely, if you're going to do something like that, don't put patient's information, PI information in there. So HIPAA violation and risk on ChatGPT because they don't offer a BAA. Remember, if they don't offer a BAA, you're really responsible for everything else. So safe use of AI. If you're going to use Copilot or GPT, set up a Copilot to search only internal files. Have it focus internally. If it's part of your HR, just use that and have it focus on your data and don't allow it to share everywhere else. Don't allow it external or web-based data scraping, and create a safe agent. It's coming faster than you think, everybody. And as you dip your toe into the AI pool, if you will, you'll start seeing the power of it. But be careful, because you're responsible for the data, not the machine. At the end of the day, this is what I recommend from a security perspective at a minimum. Strong password, Make sure you have multi-factor authentication on everything that you do. Regular updates, patch management is very important. And then make sure the accounts that have rights have the correct rights. So you don't want an admin to an admin, in other words, somebody that is just taking notes, or a secretary to have administrator rights onto your network. It's elevated rights that they don't need. So just be careful and work with your IT provider to go through and clean everything up. At the end of the day, HHS, or Health and Human Services guidance for AI use in healthcare, said that HIPAA still applies to all AI tools. AI must not compromise patient privacy, and the covered entity is responsible for that security. So if you're going to use AI, make sure security is tight because you're responsible for it. As a matter of fact, FBI warns of growing danger of cyber criminal exploiting AI. And that just happened, by the way. Claude by Anthropic, that happened last week, which is an AI that helps write code. And a Chinese firm was able to trick Claude into going and grabbing all kinds of personal information out and sharing it with it by giving it very small prompt. If they put it all together, the AI would have recognized that it was a hack, but because they used it in a way where AI did not recognize it and actually went in and got all the information that they needed and supplied it to them. But if you have strong, and by the way, they caught it because they had strong security measures around it, traditional security measures managed by humans and AI. And that's how they were able to catch it, because they had a SIM tool, they had a good MDR, they had MFA in place. Anyways, it got caught, but this is a learning experience. AI is here. It's going to be embedded everywhere in everything that we do. It's going to help physicians provide better patient care and faster patient care. But at the end of the day, the physician is responsible for the security of it all. So what I recommend is do a regular SRA, security risk assessment, a data flow, access control, storage, and retention. If you're in healthcare, and everybody we're talking to is, you have to have a HIPAA SRA done every year. And then you add AI to it to make sure that you're going through everything that you need, and to make sure that your network and your patient's data are also secure. There's too much to lose. Let's face it. One big hack gives you a bad reputation. Your patients are relying on you not only for their health, but for their data. They don't want their neighbor to know what kind of disease they have. They don't want that personal information shared among thieves. They just don't want that. There's too much to lose. So what we're offering for everybody that's listening to this webinar is scan this QR code or go to mvpworks.com/cyber, and we're going to do a free cybersecurity assessment and evaluation on your network. The way that it works is simple. We're going to pretend to be a hacker. We're not going to ask you for any credentials, no administrative credentials, no IP, nothing. We're just going to basically, we won't install anything on your network. We're going to pretend to be a hacker, and hackers most of the time gain access because somebody allowed them in by clicking on something they're not supposed to click. So what we would be doing is send you a link, and we recommend doing that on 5 different computers. So send it to 5 different users within your organization so we can get a better picture of your security. And you're going to click on that link and click run as if you clicked on something you're not supposed to click, and just continue working. So it's not going to interrupt your day. It's not going to take a long time. It's going to run in the background, and it's going to pretend to be a hacker. First, it's going to see what it can mine off your computer itself. Do you have W-2s on there? Do you have social security numbers on there? Do you have passwords that we can crack? Can I get access to your EHR? Can I get access to your bank account? Can I now jump from one computer to the other? Can I get to your server? How is your security overall? Think of it as a third-party assessment. One, it keeps your IT people honest, because if you ask them, they'll tell you how secure they make your network, and we'll be able to tell you how secure your network really is. And then 2, it at least gives you an understanding of what needs to be done to secure your environment and get you ready for AI. So we're offering for free for Dr. Cedric and all his patients, and anybody that from our that work with us as well, all get this. It's a very strong tool. It does cost us money, but we're offering it for free. and we want you to take advantage of it. We have a mission of protecting 1 million endpoints, and we are working one network at a time. So let's find out where you stand, and let's find out how secure you really are, and we'll help you get there. I hope you guys found this beneficial. This is my number. This is our office in Buffalo, New York, and this is my email address. If you have any questions whatsoever, feel free to contact me at any time. I hope you guys find this helpful. And I always like to do these webinars because I really am trying to preach out there the importance of security. We go through a lot of hacks and incident response, and I've seen grown men cry over something that was preventable. So at the end of the day, let's be more diligent out there, and let's get ready for this new technology that's about to change the world. Thank you, everybody.